Hello and welcome to AKT Boost. I'm Dr. Iain Bolton, a GP Registrar based in the north east of England and proud graduate from Newcastle Medical School. Today's episode is part 2 of the DVLA guidelines. It's packed with vital information for both the exam and your clinical practice. We're going to be focusing on 3 crucial areas: diabetes mellitus, psychiatric disorders, and drug or alcohol misuse or dependence. These aren't just exam questions, these guidelines directly impact patient safety on the roads, so let's get to it. First up, let's talk about diabetes mellitus. Until 2011, if you were on insulin, driving a HGV was off the table. Now patients using insulin or hypoglycemic inducing drugs like sulfonylureas can apply for a Group 2 licence, that's HGV and bus drivers, as long as they meet a few key standards. Number 1, no severe hypoglycemia in the last 12 months. Number 2, full hypoglycemic awareness. Number 3, blood glucose monitoring at least twice daily and at times relevant to driving. Number 4, the patient needs to understand the risks of hypoglycemia. And finally, number 5, there must be no other diabetic-related complications like visual impairments. If you've got a patient on insulin looking to apply for a HGV licence, make sure they fill out a VDI AB1I form and have at least 3 months' worth of blood glucose records using a meter with memory. Now for Group 1 drivers, that's car and motorcycles, if the patient's on insulin, they can drive as long as they meet a few criteria. Hypoglycemic awareness, no more than 1 severe hypoglycemic episode in the last 12 months, and no significant visual impairment. They usually don't need to notify the DVLA unless they've had more than 1 episode of hypoglycemia or have other complications. If their diabetes is controlled with tablets or injectables, no need to notify the DVLA unless they're on a drug like sulfonylurea, which carries a risk of hypoglycemia. Next, let's dive into psychiatric disorders. These rules can be pretty strict, especially for Group 2 drivers. For Group 1 drivers, the guidelines depend on the severity of the condition. If someone has severe anxiety, depression, or any other psychiatric condition that affects memory, concentration, or behaviour, they must stop driving and inform the DVLA. Conditions like acute psychotic disorders, mania, or schizophrenia also require notification during acute episodes. Milder conditions, such as well-controlled depression or anxiety, generally don't require the patient to stop driving. For Group 2 drivers, though, the bar is higher. If there's a history of severe psychiatric illness, especially conditions like psychosis, the DVLA may revoke or refuse the licence until the patient has been symptom-free for a significant period, typically around 6 months to a year, and this has to be cleared by a specialist. Next, dementia. Patients with mild dementia may still be able to drive a Group 1 vehicle, but they must notify the DVLA. They may also need to pass an on-road assessment to confirm their cognitive impairment doesn't affect their driving safety. For Group 2 drivers, dementia is a no-go due to the progressive nature of the condition. Finally, let's discuss drug and alcohol misuse. For car drivers, the rules are tough. Persistent alcohol misuse means the DVLA will revoke or refuse a licence until the patient has been sober for at least 6 months, with evidence of normal blood parameters. If they're alcohol dependent, the wait extends to a year. When it comes to drugs like cannabis, amphetamines, or ecstasy, the DVLA will refuse or revoke the licence for at least 6 months. If there's persistent use or dependency, then relicensing requires an independent medical assessment and urine screen. For harder substances like heroin, cocaine, or methadone, the rules are even stricter. 1 year free of use is required, and a consultant report may be needed to confirm the patient's recovery. For Group 2 drivers, the criteria are much tougher. A history of alcohol or drug misuse often results in a 3-year period of abstinence before relicensing is considered. So to recap, when it comes to diabetes, Group 2 drivers, like those operating HGVs, need to be really on top of their blood glucose monitoring. no severe hypoglycemic episodes in the last year, and they must be using a glucose meter with a memory to track those levels. Group 1 drivers have slightly more lenient rules, but still need good hypoglycemic awareness and to watch for complications. For psychiatric disorders, it's all about the severity. If a patient's dealing with severe psychosis, mania, or schizophrenia, they must notify the DVLA and stop driving until they're cleared. Milder conditions, like controlled anxiety or depression, don't always mean they have to stop driving, but it's something to keep an eye on, especially for Group 2 drivers where the rules are tighter. And finally, substance misuse. If someone's misusing alcohol, they need to be sober for at least 6 months before they can reapply for a license. For alcohol dependence or harder substances like heroin or cocaine, that period stretches to a year, with stricter rules for HGV drivers. Now let's test your memory and see what you've learnt from this podcast with 10 short answer revision questions. Question 1. What form do insulin-treated diabetic patients need to complete to apply for a Group 2 license? The VDI AB1I form. Question 2. How often must Group 2 drivers with diabetes check their blood glucose levels? At least twice daily and at times relevant to driving. Question 3. How many severe hypoglycemic episodes are allowed in the past year for a Group 1 driver? No more than 1. Question 4. What psychiatric conditions must be reported to the DVLA during acute episodes? Conditions like psychosis, mania, hypomania, schizophrenia, or severe depression. Question 5. Can a patient with well-controlled depression drive a Group 1 vehicle? Yes, as long as there's no significant cognitive impairment or suicidal thoughts. Question 6. How long must someone with alcohol misuse be abstinent before reapplying for their license? 6 months. Question 7. How long must someone with heroin or cocaine dependence be clean before reapplying for a Group 1 license? 1 year. Question 8. When must someone with mild dementia notify the DVLA? As soon as they're diagnosed. Question 9. What's the minimum abstinence period for a patient with drug misuse to reapply for their license? 6 months. Question 10. Can a Group 2 driver continue driving if they've had an episode of severe hypoglycemia in the last 12 months? No, they must not drive. And that wraps up another episode of AKT Boost. I hope this podcast into DVLA guidelines for diabetics, psychiatric disorders, and substance misuse helps you feel more confident, not just for your AKT exam, but also when you're advising patients. If you found this useful, please take a moment to like, review, and share the podcast with your fellow GP trainees. Don't forget to subscribe so you never miss an episode, and follow us on Instagram at AKT Boost for handy revision tips and exam insights. I've been your host, Dr. Iain Bolton. Thanks for listening, and remember, don't let the AKT drive you crazy.